I've got an issue with our current medical system and how they keep your knee hurt forever. This is somebody's fault and nobody's fault at the same time. It's your healthcare provider's fault, but it's also not their fault. And what I mean by this is the way that they treat you for knee problems, specifically problems like knee arthritis, chondromalacia patella, patellofemoral pain syndrome, meniscus tears, ACL tears. All these are very common knee problems that the medical field at large, throughout the entire world, the treatments that they're doing are really just keeping you in knee pain for longer. They're just delaying the problem because they're not addressing the root problem. Now, the reason why I say it's not their fault, but it is their fault, it's not their fault in that, just like anybody watching this video right now, you went through a certain schooling, you went through a certain upbringing. And whether you had parents or didn't, or had good ones or not good ones, or your school was great or wasn't that great, you got information put into your head. You got habits, you inherited tendencies from your parents, from your mentors, whoever you grew up with, your father and mother figures. This information that they put in your head, you carry with you, and it makes up your beliefs. It makes up how you see the world. It's the same thing with healthcare professionals. Once they get into their schooling, their bachelor's degree, their doctoral degree, master's degree, whatever degree it is, their postdoctorate degree, they are inheriting the knowledge from their mentors, from their teachers, from the body of knowledge out there, the research evidence that we have, that we use to form our knowledge based on the medical field. They're putting all that into people, and then they are using that in their treatments. And that's how it should be, right? At first you think, well, yeah, that's what they go to school for. But what about thinking for yourself? What about thinking case by case? That's not done as much. It's the whole idea of, like, when you're in school, they teach you facts, they teach you information, but what they don't always teach you is how to learn, specifically about knee pain. And let's just talk about knee arthritis, for instance. The treatments out there for knee arthritis: medications, injections, surgery, exercise, and then there's other treatments out there, other procedures, we'll call them. Let's just go through them one by one here. So medications, they're treating the short-term pain. We all know this. You got NSAIDs are the common ones, and that's like ibuprofen, naproxen, diclofenac. There's other medications out there like Tylenol, acetaminophen. Those are they're not NSAIDs, but those medications are designed to affect chemicals in our body, receptors in our body that help to reduce the sensation of pain. There was a story I heard a long time ago. I can't tell you exactly from who I heard it or where I heard it, but there was this idea that back in the 1960s and 70s, vehicles didn't have complicated computers like we have now, where they have all these sensors all over the car and they can tell you when there's a problem in the car. So like right now, if you have low tire pressure, for instance, your modern vehicle might show you a little low tire pressure light, an indicator that comes on your dashboard. If you have the temperature's too high, you might get a different indicator. If there's a problem with the oil, or there's many different indications. But back in the 60s and 70s, you had one red light that would turn on and you didn't know what it was. There was just something wrong. That's all you knew. And it was up to you to pull over or pop the hood open and look around and see. And they were a lot less complicated back then. But if you didn't know how to fix your car, then you were stuck. And if the car's still running, but you see the red light, what do? So there's this guy that would cut the wire to the red light. And the way this fits the pain analogy is, if you're in pain, that's your body turning on the red light. You may not know exactly what's going on. You know, is it the engine? Is it the radiator? Is it the transmission? All these issues. But you just know something hurts. And so they just go cut the wire so they don't see the red light. That's what taking pain medication is like. You're temporarily turning off the pain sensation so that you don't have to feel it. But it's not solving the root problem. In the car analogy, you're not fixing the leak in the radiator. You're not fixing the engine problem. You might be a piston or something. The spark plug needs to be replaced, whatever the issue is. That's what pain medications are. They're not solving the root problem. And I won't even get into the whole business of medications. That's a whole nother topic for another day, maybe not even for this channel. You can think what you want on that. But there's that. Then let's talk about injections. Injections when it comes to knee arthritis. You have all different kinds. There's some for pain. So the most common one is your corticosteroid injections. And that's where they're injecting a medication that helps reduce inflammation and pain. The idea behind this is weird if you think about it, because if you know anything about health, the healing process for any tissue in the body, there's inflammation, then you have proliferation, maturation, and I think there's another one. There's a series of steps that your body needs to go through in order for it to heal properly. Well, the first step is inflammation. And if you take a drug, whether by mouth or it's injected into your knee joint, and it's an anti-inflammatory medication, the thought is that it's going to reduce swelling and that sensation of your knee not being able to move as well, but you're actually stopping the first phase of healing. And this is a poor solution, in my opinion. It's a short-term solution. You know, if you're in agonizing pain, you haven't slept in days, and you just need to be able to get through a few days, yeah, then pain medication might be helpful, whether it's injected or taken by mouth. But using pain medication, injections, pain injections as a long-term solution, absolutely terrible idea. It's the same thing as cutting the wire to the red light. If you don't have that red light telling you something's wrong, you just drive indefinitely. It's just a matter of time, right? Before your car breaks down or the engine catches fire, something severe could happen. Same thing with your knee problem. Your body's telling you you're in pain. You need to figure this out. And unfortunately, doctors of medicine, MDs, that's not their specialty, figuring out the root problem. Their specialty is giving you the medication that you need right now. But there's no medication to fix a meniscus tear. There's no medication to fix knee arthritis problems. There's no medication that'll cure an ACL issue, reattach your ACL together. There's absolutely no medication to help chondromalacia patella or patellofemoral pain syndrome. They're all mechanical problems in nature. What I mean by that, it's a matter of the forces going through the knee joint, the muscles, the way they pull, the way that you move, the way you bend your knee, the rotation, all those mechanical components need to be considered, and they're not addressed by any medication or anything injected into your body. There's a few other injections we need to talk about. Hyaluronic acid injections. The idea with this, they call it gel injections. The idea with this is it's a substance that is made artificially. They used to get it out of rooster combs, you know, the little red thing that's on top of the rooster head, rooster combs. And it's supposed to mimic the fluid that they're injecting is supposed to mimic the fluid inside your knee joint. The synovial fluid is what it's called. And by doing that, they're hoping to add some cushion to the knee, especially in an arthritic knee. The problem with this is, why is there too much pressure in the knee to begin with? And people will say, oh, well, it's weight related, or maybe your age is an issue and the cartilage is worn down. But I know that's not the problem, because there's people that lose weight and still have knee pain. There's thin people that get arthritis. What the heck? I have about a third of my clients are at a normal weight, or even I'd say a little underweight, and they have knee arthritis. What about the mechanical factor, how they're moving, their muscle imbalances? That's what needs to be considered 100% of the time when we fix the knee muscle imbalance, the muscle imbalance around the knee. Their arthritis will improve, their meniscus pain will go away. They'll even heal. We had a report recently of a patient who healed. They had a MRI when their knee hurt and had a confirmed torn meniscus, went through our program and had no meniscus tear afterwards. Didn't lose any weight. They fixed the muscle imbalance. That was the number one thing to do. Same thing with the ACL tear. It's very muscle imbalance related. Absolutely, chondromalacia patella and patellofemoral pain syndrome are all muscle imbalance related. That is the root problem, not your weight. Unless you're very, very overweight, or you have some massive genetic abnormalities, like you're really, really knock-kneed or really, really bow-legged. So hyaluronic acid is a short-term solution as well. It might give you some relief. And there's not a whole lot of research on it. There's not a whole lot of research on what I'm doing either, to be fair, on fixing the muscle imbalance. The only research. It's not even official research. It's my own experience. That's what I have to give you here. I implore anybody out there, any physical therapists, any other medical professionals, to try this stuff out on your patients, because you'll be doing them a good thing. You'll be helping them out, because if you're just giving them medications, if you're just giving them injections, if you're not certain about how to work their muscles properly, go look on our channel and just implement this stuff. Get into our program and start doing it if you have a knee problem, and you'll see that it works. It just makes sense. I don't need to do a research study to prove this. Just go do it. And you know what? Tell us. Check out all the comments in our videos. People are in there saying, this worked for me. We have some haters saying that I'm a quack, or that I don't know what I'm talking about, or that you should strengthen all the leg muscles equally, not just the glutes, like I say all the time. But I always have to ask, pardon the interruption, I want to tell you about our knee arthritis recovery program. This program is completely focused on fixing the root problem that's putting too much pressure through your knee joint and setting up osteoarthritis. There's 3 components to this program. The first is a curriculum. It's me walking you through the 4 phases of recovery. In the first one, that's when you're really stiff and painful and you maybe can't get around very well, all the way to the last phase where you're doing maintenance work and you're feeling fantastic, able to get around and potentially even exercise. That's a big section of the program. A second section of the program is weekly live group coaching, where me and my staff are on Zoom talking to you, answering questions so that you're never stuck. And then the third component is a private community where you can ask questions and my team is getting to you throughout the week, as well as learn from others and see their questions and their wins so you can get encouragement along the way. Go check out the program. Back to the video. Did you try it? Or are you just saying that because that's what you were taught as a kid? That's what you heard from another doctor. Maybe you were in school for this stuff. You're in the healthcare field, and that's what you were taught in school. Don't ding it till you try it. The other injections out there, stem cells. The idea with this, in case you don't know, they're cells that are undifferentiated, meaning cells that have not become a specific type of cell yet. They're undifferentiated. So it means they haven't become like a bone cell, haven't become a cartilage cell, haven't become a skin cell, eye cell, whatever it is. And so there's potential for these cells to transform into the specific type of cell that you might need. And if you have worn down cartilage on your knee joint here because you have knee arthritis, or you have a meniscus tear, then the idea is if they inject stem cells in there, that those cells will land in the right spot and hopefully turn into cartilage cells. It's mixed right now. I can tell you from the clients that I've seen that have had this, it's about 50-50 improvement. You know, whether or not the cartilage actually, the stem cells actually became cartilage cells, I can't tell you that, but half have said, yeah, my knee feels better after I get stem cell injections. And then the other half say, no difference. And a few of those say, I actually feel worse. With all of them though, here's what I say, is that improvement that you had, if you had an improvement, is going to be short-lived unless you fix the mechanical problem. Now, I'm not here to argue the effectiveness of stem cells. I don't know. I'm not an expert in that. But what I can tell you is that even if you do actually put on brand new cartilage cells where you have worn down cartilage or a torn meniscus or a torn ACL, whatever it is, if your mechanics are still off and you're over compressing the knee joint, you're bending your knee joint inappropriately and tensioning your ACL, you're just doing bad stuff to your knee, it doesn't matter then that you put in the stem cells. It's pointless because you're just going to re-injure them. You're just going to destroy them. So you went out and paid thousands of dollars for that injection, and you have to be redoing it all the time because the doctors themselves know that this doesn't solve the problem completely. It's just a short-term thing. You're still going to mess your knee up unless you fix the mechanical problem. You've got to fix the muscle imbalance. It's those quads that are usually too strong and the glutes that are usually too weak. It might be down in your foot. You need to get stronger toe muscles. It could even be in your core. Your abdominal muscles might be weak. And you'll know this. When was the last time you felt your glutes get tired? When was the last time you felt your abs get tired? If you're dealing with a knee problem, I'm willing to bet money that you probably have weak glutes and weak abs and weak foot muscles, and you just haven't felt those muscles work out. Even if you work out a lot, you probably are using your quads too much. That's why you're in an imbalance. And if you go fix the imbalance, you're probably gonna feel a lot better. And then it's okay to use the stem cells. Like, I'm not saying don't do it. I'm just saying don't rely on it. You have to fix the muscle, the mechanical problem, the muscle imbalance, in order to get true long-term relief. Now, the other one is PRP injections. That stands for platelet-rich plasma. That's where they draw your blood, they put it in a centrifuge, and they pull out the platelets, the plasma, and then they re-inject that into your joint, and the hope is that you'll heal from that. Also mixed results, about 50-50 is what I see on those. An expensive treatment. The doctors love doing it because it doesn't cost them much. It's kind of easy for them to do, so it's a lucrative treatment for them. Might help some people, might help you, I don't know. Give it a shot if you feel like it's right for you, but don't neglect the mechanical problem. I beg you, please don't neglect the muscle imbalance. Now, the third one I'm going to talk about is surgery. So this bucket of treatments here, there's total knee replacements, and then there's full knee replacements. And what a total knee replacement is, that means, let me use my other model here. The joint's a little more accessible. There's less stuff around it. They cut off the end of your thigh bone right here. They cut off the top of your shin bone right here, and they put implants in there, a metal implant. Sometimes there's certain plastics they use. They usually put a plastic kneecap as well to replace your kneecap. And that's a total knee replacement, meaning they replace the entire joint surfaces. A partial knee replacement is where they just do half. They'll just do one side. There's other variations, but those are the two most common types of knee replacements. And the reason why these still cause knee pain later on. This happens. Like, I have made a program. I have a lot of knee programs, by the way, in case you don't know about them. These are programs where I talk step by step on how to fix the root problem related to a specific condition. Like, knee arthritis recovery program is our biggest program right now, because there's a lot of people that suffer from knee arthritis. I have a meniscus recovery program, a meniscus tear recovery program, an ACL tear recovery program, and I also have a patella pain recovery program, which is for people with chondromalacia patella and patellofemoral pain syndrome, knee tendonitis, knee bursitis, those kinds of problems. And then I have a program, a fifth one, called the failed knee replacement program. I have that many people asking me for help because they have knee pain after having had the joint replacement surgery already. They're still having problems. And many of these people, they regret having the knee replacement because they're saying, I'm the same or worse. What good did it do me if I feel the same afterwards? Or maybe I don't have as much pain, but I'm limited. That's what a lot of people say too. I don't feel like I can work out properly because my knee starts to hurt. Yeah, I can walk around and do basic things, and technically it was a successful treatment according to the doctor. These patients often go back to the doctor because they're still having knee pain afterwards. The doctor will do an x-ray of their knee, and the doctor will say, hey, well, your replacement looks just fine. Nothing's shifted, everything's in place, everything's holding, so it was a successful treatment. But then the poor patient walks out of there saying, oh, my knee still hurts. What do I do? Guess I'm just gonna have to take it because I can't, I did the last resort treatment already. What do I do? Well, it's the darn muscle imbalance. It's still there. Even though you had the total knee replacement or the partial knee replacement, the imbalance is still there. The doctors don't know how to see this. It's not their training. It's not what they went to school for. It's not the thinking that they have about this problem. It's a mechanical problem that somebody like me, a manual physical therapist, would know more about. And I've just seen a lot of patients with this. I've studied this kind of stuff. I've gone through specialty training. I've worked with the best mentors in the world on this stuff. So I can spot it a mile away, and I know exactly how to fix it, the muscle imbalance. And you know what? We put people that have failed knee replacements through muscle imbalance correction treatment, and they get better. And they're so thankful. They're like, I was giving up. I didn't know what else I could do out there because I already had the surgery. I didn't want to get a surgery done again. I was considering it because it's that bad. But now their pain starts to go away because they fixed the imbalance. And then they're asking the question of me, should I have even had the knee replacement? And I always have to answer, I don't know. I didn't see you before. It's hard for me to say what you looked like before, if there was a good chance of you not needing a knee replacement or not. But we're here now. The surgery's done. let's see what we can work with at this point. Now there's some other treatments out there, some knee procedures. One that's kind of gaining some steam is knee embolization. And what this is they're basically killing the artery that feeds the part of the knee where you have knee pain. And they're counting on, because there's a lot of recurring arteries, meaning there's arteries that back up the other arteries. There's a lot of arteries that come from both sides of the knee. And so you can kind of lose one and you can compensate with the others. And the idea is that it'll help with your knee pain because you're cutting things off essentially. And it's a similar idea with this other procedure that's out there called radiofrequency ablation, which is more common, RFA. That one's been around for a long time. And that one, they burn the nerve root that allows you to feel the pain. Could it not be more like the car analogy that I gave you? They're cutting the red wire, the wire to the red light on the dashboard by doing this. And it usually sets up more pain. It's a short-term solution, but it tends to give people relief for a few months, maybe a few years, and it ends up coming back. The pain comes back, but in a different way. Yeah, they may not feel pain in the same part of the knee, but then their hip starts to get worse, or they start to have ankle pain, or another part of their knee starts to hurt because the muscle imbalance is still there. The root problem was never addressed. So it's just a matter of time. It's just like the car analogy. Yeah, maybe your piston was messing up, but your car could still function somehow. But that's going to throw off the piston next to it, and it's going to make the engine rattle and cause another problem. That's exactly what's happening in your body if you don't fix the root problem. So these procedures out there are short-sighted. And all these doctors, it may come off as I'm throwing them under the bus, and I really am not. I really think that these doctors have your best interest at heart. In the medical field, it's like every other profession. If you've gone through school, you've had good teachers and bad teachers. You've worked with good employees and not good employees. You've had attorneys that were good and bad. There's restaurants that are good and bad. Every industry has its good seeds and its bad seeds, and the hope is that it's a lot more good seeds than bad seeds. It's the same thing in the medical field. I truly believe that more than 9 out of 10 healthcare professionals out there want to do the absolute best by you, but they're working with the knowledge that they have. They're operating under the thinking that they currently have, and they just don't know any better. They're trying to do the best by you, but they've gotten really good at doing RFAs, and the feedback they've gotten is they did this to this patient, they followed up with them a week or two or a month later, and the patient said, my pain is better, and they don't follow up with them anymore after that. And you know what? 3 months later, 6, 12 months later, the patient's saying, my knee hurts again, or my hip hurts now. And you know what? That RFA procedure did not work. It only worked for a few months, and I don't want to have it done again because I'm burning my nerves. Or they have the surgery, the knee replacement surgery, and they're thinking, you know what, it's better, but not great, and I don't want to bother the surgeon again. Something's wrong with me. I'm just getting older. They have that thinking in their head. And so I really think healthcare professionals are doing the best by you, surgeons, doctors, nurses, everybody, but you're just seeing the wrong professional. You're seeing professionals that are helping you with short-term solutions. You need to see a professional that can help you fix the root problem and fix get you relief for the long term. Now, one more category I want to talk to you about is exercise. We know by research that exercise is very helpful, but what we don't know in the research is which exercise is helpful. And so if you look at the research for knee arthritis, for meniscus problems, ACLs, all that stuff, it's confusing. Some research says that this exercise is good, and then there's other research that says that the same exercise is not good. It's absolutely confusing. Stretching versus using weights or not using weight, walking. There's just so many different ways to split exercise, so many variables in exercise that it's hard to know exactly what to do and who to listen to. And then a big variable is what your body responds to, what your current strength is like. There's just so many aspects to this. Most people with knee problems who end up being sent to a physical therapist end up doing exercises at physical therapy, exercises and stretches. I want you to just make sure that those exercises feel good for your knee. They should be helpful, not harmful. If you're having to grit through exercises that are causing you more knee pain, especially if you get swelling in your knee, especially if you don't feel like you're able to walk better the next day or two. You know, and soreness is a thing, you know, muscle soreness, but you shouldn't have soreness in your knee joint. There's no muscles right here in the knee that are going to get so sore that you can misinterpret it as knee pain. The muscles that get sore whenever you're working out your knee are going to be in your thigh, in your hip, in the calf, maybe in the foot. You do have muscles in the foot too. But if you have more knee pain, like right around your kneecap or deep in the knee, that is not muscle soreness. That is you're messing up your knee joint. So you need to tell your healthcare professional this. And if they aren't making the right changes to help you out, then you need to make the changes yourself. Go find the right expert that can help you avoid surgery, that can help you fix the root problem. Now, I've got all those programs that I mentioned a while ago. You can find links to the programs in the description, or look through our website or our YouTube channel. You'll find links for all that stuff. Whether or not you get into the program, I don't care. I just want you to make sure you're on the right track and that you're doing the treatments that are best for you. So I don't want you to be in pain forever. I don't want you to be pursuing the next wrong treatment. Don't avoid fixing the root problem. Hey, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it. And it doesn't matter how severe it is, if you've had it just mild, you know, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program, and there's different tiers of this. On the first tier, it's group coaching, along with the whole curriculum of 40 plus, I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements, but you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too, and of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program, and I hope to see you in the program on our coaching calls.